More than 80 million Americans nationwide, and counting, are currently covered under Medicaid, with Latinos making up 1/3 of all beneficiaries. The program, which provides medical and hospital coverage to those in need, has been a lifesaver for Latino communities. Latinos make up a disproportionate number of the nation's uninsured, more than double the broader U.S. public. In 2019, nearly 4 million Latino parents and almost 2 million children didn't have health insurance. And that's despite the fact that Latinos are behind some of the most critical jobs that keep this country running, such as janitors, cooks, EMTs, and so much more. Many Latino adults covered through Medicaid are working, and they're working hard. But few may have access to health coverage through their jobs, which trickles down to the rest of their family. Other factors contribute to these high rates. An estimated 60% of the country's Hispanic workers earn less than $15 an hour, and health insurance premiums are prohibitive to those that don't earn living wages. Over the past few years, many Latinos that would otherwise be eligible have also fearfully shied away from applying. The Trump administration's 2018 public charge rule announced that accessing public benefits could affect someone's permanent residency application. While the Biden administration eliminated this barrier, the Trump presidency's messaging continues to deter some from applying to this day. Even so, Medicaid and our public health system have evolved over the years to address those being left behind. In 1997, the Children's Health Insurance Program, CHIP, significantly expanded health access for kids, especially those in Latino families.
Because we have acted, millions of children all across this country will be able to get medicine and have their sight and hearing tested and see dentists and doctors for the first time.
Through CHIP, states provide health coverage to children and families who earn too much to qualify for Medicaid but can't afford private insurance for them.
Under this law, the share of Americans with insurance is up, and the growth of healthcare costs is down.
In 2014, the Affordable Care Act also called for the expansion of Medicaid to cover more adults with incomes below 138% of the poverty level. That's roughly $17,000 in annual income for a single person, and about $30,000 for an adult in a household of 3. To date, 39 states and DC have adopted Medicaid expansion. In many of these states, we've seen the uninsured rate for Latinos decline. But those with large Latino populations that have not, like Texas and Florida, have some of the nation's highest uninsured rates for Hispanic families. In the current political climate, there doesn't seem to be a lot of consensus on key issues, but the majority of the American public does have a favorable view of Medicaid, and that support extends across party lines. Among Latinos, 7 in 10 voters believe the US government has a responsibility in ensuring all Americans have healthcare coverage. What's more, studies have found that the healthier citizens are, and the more healthcare coverage they have, the better that is for the economy overall. Medicaid is a lifeline for Latinos and other marginalized communities, for the people who need help the most. And the COVID-19 pandemic made that very clear.
Los hispanos se están contagiando más que otros grupos demográficos.
Por ejemplo, en California, los latinos son el 39% de la población, pero son el 57% de los nuevos casos.
About half of US Latinos say they have faced health and financial challenges during the pandemic. Some saw their pay reduced or lost their jobs entirely. And even more, lost loved ones. As the US looks to bridge some of these disparities, public health experts believe Medicaid expansion could help close some of these gaps. And we're already seeing those results. A 2020 survey across 5 swing states found Medicaid expansion provided better access to care, helped eliminate financial barriers that would prevent people from seeking care, and ultimately improved health outcomes for communities. Medicaid isn't a perfect program, and there's still more work ahead to ensure all Americans have the security and dignity they deserve. But Medicaid has made it possible for several generations of Latinos and other marginalized groups to continue to make strides by getting quality health and medical care they wouldn't have otherwise because of it.